Hello, my name is Olave, and today I'm going to talk about a very interesting muscle, the tibial muscle. But first, you have to know what are the muscles. As everyone knows, the muscles are the result of the union of the tissues. The muscles have the mobility and stability of the body. The human body has approximately 605 muscles, so as we already know that they are the muscles. The tibial muscle is located on the lateral or external part of the tibia, part of the lateral condyle, and the upper two-thirds of the upper surface of the body of the tibia. Certain fibers also originate from the adjacent portion of the interosseous membrane, the deep surface on the fascia, and the intermuscular septum that exists between the tibialis anterior itself and the extensor-digital longus muscle. Muscle fibers originating throughout the leg bone follow a downward path, ending at the tone of the tendon that appears in the middle third of the leg. From its various starting points, the muscle takes a fusiform shape with fibers relatively parallel to the plane of its insertion, ending in a tendon that begins in the anterior and internal portion of the dorsal aspect to the foot, near and the ankle. After passing throughout the innermost compartments of the transverse and cruciate ligaments, it inserts on the medial or internal surface of the medial cuneiform bone and at base of the first metatarsal bone. In its course, the muscle overlaps an anterior tibial vessels and the peroneal nerve, especially in the upper leg. Now that we know what is located, I will talk about function. It is very simple. When the foot is on the ground, the tibials anterior have to balance the leg to keep it vertical, even on uneven ground or while walking. So the movements of the tibial anterior are essentially dorsiflexion and inversion of the foot. And now I'm going to talk about the disease that occurs in this muscle. The disease is called tibial periostitis. What is tibial periostitis? Tibial periostitis is a pain on the inside of the tibia. It is usually caused by running or other high-impact activity. Tibial periostitis improves with rest and does not cause long-term problems. What what are the signs of and symptoms of the tibial periostitis? People with tibial periostitis feel pain along the inner edge of the tibia. The pain usually appears during activity or just after activity. Tibial periostitis can also cause inflammation and increase sensitivity in the tibia. What are the causes of the tibial periostitis? Tibial periostitis pain is caused by irritation and inflammation of the muscles, tendons, and bones of the lower leg. Tibial periostitis is an overload injury. It usually appears that the person makes the same movement over and over again, for example, while running. It can also occur if a person makes a sudden change in a physical exercise routine, such as exercise more frequently or doing more intense training. Who develops tibial periostitis? Tibial periostitis occurs in people who perform high-impact activities with frequent stops and starts, such as running, jumping, dancing, or practicing basketball, football, or soccer. Some things make a person more likely to have a tibial periostitis. Among these are the following: have flat foot, exercising with worn-out sports shoes, being overweight, have little flexibility in the hip and ankles. How is tibial periostitis treated? People with tibial periostitis should reduce or avoid all the activities that cause pain. In general, work and exercise that do not require bearing your own weight, such as swimming or cycle, are painless and you can continue these activities. To help with tibial periostitis, your healthcare professional may recommend the following: place a cold compress or ice on the tibia every 1 to 2 hours. from 15 minutes. Place a thin towel on the skin to protect it from the cold. Take plain medication such as ibuprofen, Adulmotrin or Astorvent, or acetaminophen, Telon or Astorvent. Follow the direction of the medication about how much you can take and how often do stretching and strengthening exercise from the muscles and tendons of the foot and leg. Wear an elastic bandage or compression stocking to help relieve pain and inflammation. And well, that would be all I have to say about the tibial muscle. Thanks.